Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and today's topic is stroke intervention and vascular neurosurgery. Joining us to talk about that is Dr. Ashish Sonig with Willis-Knighton. Thanks for joining us.
Thank you for having me.
Absolutely. So you are not only a neurosurgeon, but you're also the director of the Neurovascular Institute with Willis-Knighton, correct?
Yes, correct. So yeah, it's an interesting story because, I did my initial skull-based fellowship in Shreveport.
Okay.
That was back in 2013 at LSU. And then, we were in touch with Willis-Knighton, and then finally they got all the things that was supposed to be needed to open the institute of that magnitude.
Cool.
So we started this in March. And it's a completely comprehensive neurovascular institute where you can have care for basically carotid disease, stroke, aneurysms, any vascular abnormality of the brain, or deep skull-based tumors.
Okay, gotcha.
Yeah.
So just a really great specialized place for people in the Architects to go to if they have any of those issues. So you also mentioned to me that we've got some exciting news that you could share for the Architects, just for Willis-Knighton, and it kind of puts a stamp of approval of the quality of care that you guys provide.
Yes, absolutely. And I think it's just a coincidence that a week ago we received the approval to be one of the sites for a national and international trial, actually. And this trial is basically to take the stroke thrombectomies. In layman terms, a thrombectomy means that you're going with a specialized device inside the human brain vessels, and you pull a clot out of it. Usually what is approved is when the vessel is very large in lumen, so it's much more technically easier and feasible. And now we are going to the next level, going to a vessel as small as 1.5 millimeter in length, in diameter. And you can go there with special devices and technique, and then you can pull the clot out depending on how the patient's symptoms are. For that, you need to do a trial, and ours is the approved place. It's the first hospital in Louisiana to be the approved facility, and possibly the fourth hospital in the entire southern U.S. to be part of this very prestigious trial.
That's awesome. And like we just mentioned, the FDA is the entity that approves this?
Yeah, the entire trial is approved by the FDA, and so they have to we have to work with them, submit our data and the care, and there will be surveys, and they will come to inspect the sites. So this basically tells indirectly how robust our plan here is, and the services that we provide, and the technology that we have, and the skill set that we have from our medical staff.
That's awesome. Great. Yeah.
Thank you.
So you're a neurosurgeon, and that kind of deals with a lot of your brain and really intricate things. So what made you decide to go in the specialty?
Yeah, it's kind of interesting. So when I was in my med school, during medical school, you rotate in different specialties. So you go to general surgery, you go to neurosurgical theater, and there I saw one of the neurosurgeons operating a patient. We call it a sitting position, actually. So patient is actually sitting on the operating table, and he's under anesthesia, and the heads are clamped, and obviously the head is shaved. So to me, it was so fascinating. It looked like a monk is in some kind of a meditation, and somebody is operating on the brain.
Yeah.
And that kind of tell me this is it. I always wanted to do something with my hands, and I said, if I want to be a surgeon, I want to be a neurosurgeon.
Very cool. I love that. Okay, and so as we mentioned earlier, stroke is very common in the United States, right? And we're going to kind of talk about stroke intervention, maybe things that you would do to help treat it, advancements in that regard.
Yes.
So talk a little bit about what you do to help prevent stroke or treat it.
Correct. So stroke in general, for the understanding, I think people are very, very aware of a heart attack, and they also are aware of the symptoms of a heart attack, that when you have a chest pain or you're restless, go to the hospital, you may be having a heart attack. Similarly, brain works in a similar fashion. There are brain vessels that can get clogged, and when they get clogged, the symptoms are depending on what part of the brain they are supplying. If they're supplying the speech, then you can have difficulty in your speech or understanding how you are. If they're supplying the area of the hands or arms or legs, then accordingly you can have weakness. Sometimes the artery involved is a major branch of the brain vessels, actually, and then you can have the entire full spectrum of stroke. So you can have a minor symptoms to even a transient symptoms to really a major symptom that can even render you unconscious or completely weak on one side of your body. So whenever you are experiencing those symptoms, the best way is to go to the hospital and be evaluated. Do not ignore these symptoms. Even if you're on the mild variety, this could be a warning sign of something big happening in future.
Yeah, so this is definitely a medical emergency.
Correct.
Call 911.
Yes.
Get to the emergency room as quickly as possible.
Absolutely.
Okay, and why is it such an emergency? What makes
Yeah,
it life-threatening?
so the most important thing is time is brain. You know, every time when you have a stroke, when the artery is blocked, within seconds you can lose millions of neurons. So the earlier, the sooner you go to the hospital, the better it is to get the care. And the care at the hospital can range from a simple drug, it's called the clot busting medication, like a TPA kind of medication, where you inject them based on the criteria and the timing. And generally you can give this medication when you're within 4.5 hours of the stroke. But good thing is that, let's say assuming, you having a really a serious kind of stroke symptoms, which is making you completely weak in your arms or leg, and your symptoms are of like higher degree, and you reach the hospital even let's say by 6 hours. So even at that time, what happens is that you can still be eligible for a thrombectomy procedure where I will go in and with special devices and pull the clot out of your brain actually. So, and with specialized imaging that we have now at Willis-Knighton, we can actually do the thrombectomy within 24 hours of stroke symptoms. Wow. So unlike other times, it was initially 6 hours. Now the time zone for such procedure has been extended to 24 hours at a place which has this imaging technology that you can figure it out what would be the patient who are safer to do this procedure in 24 hours, and we have those.
That's awesome. So that's a huge advancement, I'm sure, in the technological aspect as well.
Correct.
So if you're just joining us, Healthline 3 is where we like to focus on ways to live a healthier, happier, and pain-free life. We'll be taking your calls and answering your questions right here live in the studio today. We'll be opening those phone lines right now. You can see that number on your screen, 318-219-4569. So be sure and give us a call. But when you do call, make sure you're in a quiet room or your TV's turned all the way down so that we don't give it any feedback and so we can hear your question clearly. Again, 318-219-4569. Okay, so you were talking about maybe getting the clot out, right, during that procedure, and
Correct.
That's what you call the thrombectomy?
Absolutely,
okay.
Yes.
And so is this something that is newer technology that patients now have available to them?
Right, yes. So it all happened, back in the year 2015 and 16. I was doing my fellowship at one of the largest places in the country at Buffalo. And that was the trial site for when these kind of procedures were being doing. And we were enrolling the patient as a fellow in that thrombectomy trial. And we were comparing with the standard of care at that time, which was a clot busting medication. And we were going in with devices to pull the clot out, and we found the results are so overwhelmingly in favor for this procedure of thrombectomy with the devices. That's when the guidelines came. So this procedure, what we are doing, is available for the last, I would say, 8 years, 9 years.
Okay.
So it's a newer procedure, and things have changed dramatically in the last 8-9 years in terms of the safety of devices. We have new special devices. The one which we'll be doing here, testing in our trial, it is as small as it can go into a vessel which is a millimeter in diameter. And you can pull a clot in a vessel which is like a 1.5 millimeter in diameter safely.
That's awesome.
And the device has already been in the market for the last 2 years. It has already been seen working in other human conditions. But in order for guidelines to come, you need to have a randomized trial, and that is what we are doing right now. It's an international trial which is going in like in Germany, Switzerland, France, and at least like 20 plus centers in US.
Gotcha. Okay. And you mentioned you have to go in and do a lot of imaging and maybe tests
Correct.
before you do something
Yes,
like
yes,
this.
yes.
And what are you looking at?
Yeah, so assuming a patient is having a stroke right now and he goes to Willis-Knighton Medical Center, the North, which is the main center for thrombectomies. So he will have a set of imaging, which will comprise from basic standard CT scan to look for whether there's a bleed or some kind of ischemia. Then it will have an imaging called as an angiogram, CT angiogram, which is a non-invasive way of knowing how your brain vessels are and can tell me whether there's a blockage or not. Then comes another extra imaging we call as CT perfusion, which is very special actually. It can tell me what part of the brain is getting less flow, how much less flow, whether it is dying or already dead. I can get all that information based on that imaging. And the cool part is that we have that artificial intelligence application in our cell phone that even if, let's say, a patient is having an imaging at Williston North, I can have the picture real time in my cell phone.
Oh, wow.
And our app is connected to all the 4 hospitals, which is Bargier, Piermont, and South Hospital of Willis-Knighton. So at any places, anyone is having a stroke imaging, I can look at my phone and I can say that whether he would need a thrombectomy or not. So that we are not wasting time in going to our online system of PACS, downloading. We can make decision in a matter of seconds.
Yeah, which, as you mentioned, time is
brain,
everything.
that's why.
Yeah. Okay. So, and you mentioned the time limit is within the 24-hour window now.
Right.
Okay. Well, that's incredible, though. So, now kind of transitioning to brain aneurysms.
Okay. Yeah.
Another area of yours.
Right.
Oh, I think we have a phone call. What was the name? Merlin. Thanks for joining us, and I'll give you time to put your earpiece in. Thanks for joining us. And what is your question?
Hi,
well,
Merlin.
I had a little TIA, and it took me to the wrong place, and I got disgusted and came home, and now I have a slight speech impediment, and I wonder what it is. I am a VA patient, and I'm an ex-Marine sergeant, and I will be 92 in January the 6th. What is the best thing for me to do towards? I can read anything, but speaking very quickly, I have a problem with that.
I can understand, because when I'm talking to you, I can hear that you are basically kind of losing the fluency of your speech. Your comprehension is intact. This tells me that what event that you had was not like a TIA. It must have been a stroke, an actual stroke, because TIA is like a transient attack in which you lose symptoms and you come back to normal within 24 hours. In your case, your speech difficulty is persistent. Now, another question here, another thing I should tell the viewers is age is not any detriment here. There is no upper limit for stroke treatment, and it depends on how good you are at baseline. So if you're an active individual, I would suggest that you must visit your nearest primary care if that is you can, or you can come to my clinic and we can take a detailed look at that, because
I go to the VA for all of my medical appointments.
Got it. So what you would need is you would need basically a scan of your neck and a brain to see if there's anything abnormal with your vessels of your neck or brain that could be the cause of the stroke. That's one of the most common causes of stroke. The second most common cause of the stroke is the heart. Any problem with the heart, like a heart failure or atrial fibrillation or arrhythmia, that can be the cause of the stroke. So if you're at VA and you go to the clinic, you must go to your primary doctor and express your concerns, and then he can connect you with a neurologist or a neurosurgeon or even a cardiac doctor if that is needed too.
Okay. Now, I have been in the VA since 1983 or 4, and I did not. I had I guess you would call it a stroke about 11 months ago, and my two middle fingers on my right hand got very numb, and my wife was just coming home, and she called the fire department, and they took me to South, and the lady there said, if you don't go over there and sit down, I will not wait on you. So I was sort of disgusted at that time. So I went over and sat down, and I finally left there disgusted and come home, and that's why I have the situation that I do have. Is there anything I can do at the VA to help myself?
Yeah, no, you can definitely. As I just suggested, that best is to contact your VA doctor if you have a primary care physician, and then you can see a neurologist. And if the VA does not have a neurologist, then I'll be more than happy to review your images. If you go on my website, wkneuro.com, there's a place where you can upload your images, your clinical history, and I provide free consultations over there. And I can give you my opinion what needs to be done next. In case when you're telling me that your 2 fingers got numb, that can also happen with a cervical spine problem, not necessarily a stroke. So I think you would need a good detailed examination by a neurologist or by a neurosurgeon. If that is not happening, I can connect you with my clinic staff, and I should be more than happy to see you there.
Well, I try to do everything with the VA. I'm a Purple Heart veteran and a Korean War veteran, and I would like to know if who I could see at the VA to.
So I do not know on top of my head who would be the person at VA, but I can help you if you can let me know your details. My office will be more than happy to call you back and connect you with the right people at VA.
Do you have a phone number that he can
Yes,
call?
you can call my clinic on 318-212-6797, and you can reference our conversation here, and my office staff would be very happy to help you to get connected with VA people.
Absolutely, yes. And yeah, thanks for providing that. Yeah, and you said wkneuro.com?
Yeah, wkneuro.com. Yeah.
Okay, and you do free consultations?
Yes,
with
absolutely.
That. That's awesome.
Right.
So you can just upload maybe what's going on?
Yeah, absolutely. You can upload your pictures through your phone or through your computer, and then I can see them, and if something is worrisome, I can tell you, yeah, it's something worrisome and I need to see you, or somebody else needs to see you.
Okay, that's fantastic. Well, Billy, thanks for joining us. And what is your question for Dr. Sonig?
Say it again.
What is your question for Dr. Sonig?
Oh, yeah. Hey, Doc. Well, listen, I've been listening to you talk and being so helpful to everybody. I wanted to ask you a good question.
Okay. Hello.
What's your question?
What's your question?
I have a brother that went ahead and he's an amputee since about 25 years ago.
Okay.
And went ahead and he fell with a stroke about 2 years ago, close to. And we're just trying to figure out how we can get his body up and going. And he's been through therapy and everything with 24/7 since for 2 years, and don't know if it's spinal or maybe it's something that maybe neurology, his mind or nothing. We can't understand how come he can't use any of his limbs now.
So what you're suggesting that he cannot use or move both the upper arms and both the legs?
No, he had his one leg amputated and his right arm fused, with his bike accident. So since he's had a stroke, now he can't use either leg or his arm that was actually working.
Okay, sorry to hear that. To be honest,
Yeah.
in that case, I'll have to review the brain MRI and the neck MRI to understand whether the problem is happening because of something
Yeah.
stroke that happened in the brain, or it's a problem that is happening at the level of neck. Sometimes
No, it's absolutely in the brain. Yeah, because he can't function.
no. So normally, if the person is able to talk and understand everything, just like me and you, we are talking, then it's possible that some patient can have a spinal injury also, which can also kind of make them weak in both upper extremity and lower extremity. So he would need
Oh, yes, sir,
basically
yeah.
he would need basically to be seen by a neurologist or a neurosurgeon. Either one of them should be the one to make that determination. Now comes the rehab part. Unfortunately, there are not too many advances in the rehabilitation
Right.
of patients who had old stroke. There are new things are
Right,
coming in right now.
it's been so limited here in Shreveport and Bossier. It's so limited because of we have to go sometimes down to Houston to have all this things done because
To be
they're
honest,
limited up
for
here.
that part, I think we now have complete comprehensive care of stroke and vascular neurosurgery in here. I can say with 100% certainty, there is no neurosurgical procedure that can be done in the country which cannot be done at Willis-Knighton Hospital Group here, including most complex aneurysm, stroke care. Yeah, please call my clinic, and my number is 318-212-6797. And if you wish to upload,
212
yeah, 212-6797. And if you have some images,
6797.
yeah, if you have some images, you can go to my website, wkneuro.com, and you can upload some
yes.
pictures and images, and I'll be more than happy to look at them and reach out to you.
Yes, sir. Well, he's got plenty of them, I'll tell you that. Okay, well, thank you, sir. I won't keep you on the line that
Have a
much.
good day. Thank you.
Thanks for calling in. All right, so out here helping lots of people today. Yeah, WK Neuro, and that's just a great option for people. And we've got another caller on the line. Thank you, Sherry, for joining us. And what is your question today?
Oh.
Hi,
Hello?
Sherry.
Yeah,
Yes.
hi.
Yes, sir. I just recently stroke, and it was a TI stroke, and I went to Oshner, and
Do
they
you mind
told me
turning
that
your TV down for
my-
us, please? Sorry, we're getting
Yes,
that
ma'am.
feedback. It's a little hard to hear your
Okay, sorry,
question.
can you please
And
repeat your question
I-
again? I missed the initial part, sorry.
Yes, sir. I recently had a stroke, and they said it was a minor stroke, and
Okay.
it said it came from my left side of my brain.
Okay.
And first they did a CAT scan. They couldn't find anything. Then they did an MRI, and that's when they found it. And the whole right side of my body went numb. And first I want to tell you the Oshner workers and the doctors and the nurses, they were the greatest. They were awesome. They quickly found out that I had had a stroke, a minor stroke. But my question is, my right side of my foot has never come back to normal. It's totally numb, and my right hand is totally numb. And I don't know what to do. But the rest of my body went back to normal because when I first had my stroke, I couldn't even feel my shin.
I see. So what happens in a stroke is that it will always leave you with some scars. So if your MRI of the brain was done and that showed that you actually suffered from an acute stroke, so it will leave you with some scars. Some of them will recover, some of them will remain forever. So if after time of your stroke, generally you should give at least like 3 months to 6 months for your symptoms to improve before you can say that, you know what, whatever you have is now permanent and reversible. So if that was the cause of the stroke, and when I see the MRI, I can tell what kind of location of the stroke is and how it would basically make an impact on the patient. So if your MRI of the brain can explain why you're having the numbness in your hands and feet, then that's it, then nothing else needs to be done. However, in some cases I have seen that the MRI is showing some stroke somewhere else, but patient is having symptoms which does not correlate with your MRI. In that case, you may have to do another next level of investigation or imaging of your neck and the neck MRI, and then and how it goes. So I would suggest you, in your case, give your time and also follow up with your neurologist. You need to follow up with a stroke neurologist if you are falling at Arshner or any other hospital, who can come and see how you are. And you also need a workup to tell you why you had a stroke in first place. You need to know the reason why so that the treatment can be started for that. Sometimes this problem lies in your carotid arteries of your neck or the brain vessels, or sometimes the problem lies in your heart. So you need to know what exactly went wrong so that you can have a customized solution to prevent a future stroke from happening. That's how I treat the patient when they come to my clinic or when I'm consulted.
All right, great advice there, Dr. Sonig. And you know, we've talked a lot about strokes. We have just a couple of minutes left. So really quickly, 4 minutes to be exact.
Okay.
In you know, simple terms, tell me a little bit about brain aneurysms.
Yes, so brain aneurysms, you know, it's very important to know that there's an entity that exists. It's in the technical terms, it's called as aneurysm, but in layman terms, imagine you have a kind of a tube, which is your blood vessel, and then you have like an outpouching, like a balloon coming out of it. So when you, at some point of time, the balloon will get inflated, at some point it's going to burst. And when it bursts, it's called as a ruptured brain aneurysm. Now that's a very serious condition because 50% of the patient who will have a rupture, they won't even come to the hospital. They will die where they were.
Right.
And of the other 50% when they come, only few of them will survive and will make recovery when they can have really a faster way of treatment. So if you have any family member who has aneurysm, please contact us or at Willis Netton North, and we can do the screening because you are at risk of 18 times compared to the normal population for a rupture. So the importance is be aware. If you're having symptoms of sudden onset of severe headache, that could be an early sign of brain aneurysm or could be actually the sign of the brain aneurysm rupture. So in that case, come to Willis Netton North. We have a comprehensive stroke center. You can call my clinic if it's not an emergency. It's 318-212-6797. And when you come to the Willis Netton ER, we have complete care of doctor available 24/7 who can do your CT scan imaging. And then being a neurosurgeon, I can decide to do either an open brain surgery to treat them, or I can treat them just by the endovascular means, the way we treat stroke. So both the options are available here.
Awesome. Yes. And you would recommend the CT scan as that
Correct.
screening.
Right.
Okay.
Yeah.
And you can do that all at Willis Netton. As
Absolutely.
you mentioned, there's really no need if you live in the Arklatex to go really anywhere else for
Absolutely.
neurovascular needs.
Yes, absolutely. For neurosurgery, for skull base, deep tumors, anything. And as I said earlier, and I want to reiterate the same, there is no procedure that can be done in the country, vascular procedure, which we cannot do here at Willis Netton North.
Okay, awesome. And we've mentioned this several times, but wkneuro.com is the website that people can go to.
Correct.
And you personally read through all of these submissions.
Absolutely. They just come directly to my inbox.
Okay,
Yeah.
love it. And so you will be able to, do you typically respond via email or do you give them a call?
I can choose both of them depending on how things are. Sometimes they are not available on phone, so I just say email them or I leave a voicemail.
Okay, and then from there you probably would recommend maybe it's time to come
Correct.
in for a consultation. Do people need referrals to be seen by you?
Yes.
Okay,
Yeah.
so ask your primary care physician
Absolutely.
for a referral.
Yeah.
Okay, and if not, maybe just give your office a call and maybe discuss
Yeah,
next
I can see
steps.
directly as well. You can call my office and we can make a direct appointment, referral or direct, everything is there. And I
Okay.
can give appointment next day also. We have staff enough to handle that kind of volume.
Okay, and I think I know your number by now. It's 318-212-6797.
You got it.
Okay, I've said it several times, but it's right there on your screen as well, wkneuro.com, and the number to call. Well, thanks, Dr. Sonig. This
Thank
was
you.
your first Healthline, and you handled it like a pro. So thanks for joining us, and thank you for joining us. If you have any questions or want to watch this and rewatch it, it's at I'm almost saying your website. It's ktbs.com/podcast or ktbs.com/healthline and the number 3. Thanks for joining us.